Well, good afternoon. We'll call our weekly briefing session to order. I'll call it to order. Sound like in the city council meeting. We'll start our briefing today. City Manager Zanoni is on a conference call, and I believe it's dealing with potential weather issues, so he won't be here. But Net Rodriguez, Public Health Director, will follow me on my comments, and then Judge Canales will be here to issue some comments and continue the information that she wants to share with us. But I think the big news today, other than I think we got some great numbers, at least on the case side from what Annette briefly showed me, but I'll let her give you that information. But the governor held a press conference today, and I'll hit some of the high points of the governor's order relating to COVID, and the judge then will expand on that and how it impacts the county, because their orders will affect the whole county. And I would imagine that once the judge issues her orders to coincide or mirror what the governor has issued, that the city will likewise do the same. So just for those of you that are interested in the big picture, and then you can go to the website either at the city or the county to find out what the governor's latest orders are. And so let me just begin by saying that. The number one item that I think most folks are interested in, particularly those of us in business, that on Monday, September the 21st, that'll be, I guess, next Monday, well, at midnight Sunday night, or 12:01 a.m. Monday the 21st, the business capacities for the state of Texas, with the exception of 3 areas, and we're not one of those 3 areas, will increase to 75%. So restaurants and other establishments can bump up from 50 to 75%. This is in retail stores, dine-in restaurants, office building, manufacturing businesses, museums, libraries, and gyms. Bars will remain closed at this time, but can operate through the drive-in operation or the pickup operation or the delivery. Then I know a lot of people will be extremely pleased with this, that on Thursday, September the 24th, and this has been a big issue for a lot of people, and it's been a very difficult issue for a lot of people, but beginning Thursday the 24th, nursing homes, state-supported living centers, assisted living facilities, and long-term care facilities will be open to some visitors. So I don't know the details. Possibly the judge might expand on that, or they're probably in the orders in the fine print. But I wanted just to give you the highlights so that you can kind of be planning and then find out if you're one of those that will be allowed to go into the nursing home facilities. This has been a big issue all this time, and it's been very painful for a lot of families. So this is a great mark here. As long as social distancing is observed, and this goes for everybody, we're not relaxing any of the social distancing requirements, but there's no occupancy limit beginning on the 24th for cosmetology salons, barber and nail salons, massage parlors, tattoo, and piercing studios. So, but you do need to maintain the required distances. And then probably the last one that probably will hear some amens from this is that there's also no occupancy limit on the religious services, local government operations, and I think I'm going to have to get the city attorney to look at that to see how that impacts the city council and the public comment period, which if we can get back to what we're normally doing, that would be great, but we'll still have opportunity for public comment if that doesn't apply in the fine print when the legal people look at it. But we'll continue to provide public comment, but if we can get back to the way that is customary before this happened, that'd be great. So then no occupancy in religious services, local government operations, child care services, youth camps, recreational sports programs, public and private schools, drive-in concerts, and movies. So it looks like we're moving in my opinion, it's a great step forward. Like I said, the judge will give us a little more insight. She's got the legal training to do that. I don't, but that's how this is going to impact Nueces County and in turn will impact Corpus Christi. So Annette Rodriguez is going to come in just a moment to give us the numbers, the statistics on COVID, and then Judge Canales will come and shed some more light on the governor's orders and possibly have some explanation into some of the details. But those are the big bracket items, and I think for those of you that are out there listening, that could be pretty exciting news, and we'll see what both the city attorneys and the county attorneys, after looking at the details and giving the city manager and the judge their interpretation as to just exactly how far these are going and can be applied. That's what we'll do. And so that sounds like, to me, a great step forward today on the behalf of the governor and for our businesses here in town. So for those of you that have been under the 50%, you can start having 75% come the 21st. And for those that have been on the restrictions in terms of visiting, that sounds like it's a great thing for our senior centers and the long-term assisted living facilities. So that's great news. At this time, I'll call on Annette Rodriguez to come and give us the information on our work and our numbers today in terms of the COVID. And then, like I said, following her, Judge Canales will come.
Hoy el administrador de la ciudad no va a estar presente, pero vamos a contar con la directora del Distrito de Salud, Annette Rodríguez, y la juez del condado, Bárbara Canales. Hoy el gobernador dio una actualización en cuanto a sus órdenes ejecutivas, aunque todos los detalles de las órdenes están en nuestro portal de internet. Las órdenes entran en vigor el próximo día lunes. Entre estas, los negocios que podrán operar al 75% de ocupación son las tiendas, restaurantes, edificios de oficinas, manufacturadores, museos y bibliotecas, gimnasios, instalaciones para hacer ejercicio y clases. Los bares continúan cerrados a menos de que se entreguen las bebidas a domicilio, por ventanilla o entrega en persona. El día jueves 24 de septiembre entra en vigor las visitas a centros de asistencia para adultos mayores, así como asilos de ancianos estarán abiertos para algunos visitantes, siempre y cuando se adhieran a las reglas establecidas por el Departamento Estatal de Salud y Servicios Humanos. Otros establecimientos están abiertos sin límite de ocupación, siempre y cuando exista el distanciamiento social. Entre estos, los salones de cosmetología, salones de belleza, cuidados de uñas, masajistas y estudios de tatuajes. En donde no hay límite de ocupación es para los servicios religiosos, operaciones locales gubernamentales, servicios de guardería, campamentos de jóvenes, programas deportivos recreacionales, escuelas públicas y privadas, conciertos móviles, autocinemas o similares. Ahora la directora del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte.
Thank you. Annette Rodriguez, Public Health Director. So I am going to give the COVID-19 numbers today, and I'm going to start with our bar graph. And I have some really exciting news. Is the bar graph? I'm going to wait a second for it to come up here. There it is. This is the exciting news. So single digits. So we saw single digits back on Saturday, and then they started creeping up over the weekend. Made me a little nervous here because we went from 24 to 44, and then 44 again, and then 22, and now we're back to single digits. So that's a really good sign. And I know you see the numbers a little differently because we have the state, what we call the data dump. So, but these are the true numbers of what we're getting locally of new COVID cases. So, next slide. So if you look for the data dump, there wasn't anything here. It went all the way back to 9/4, and that's where you see some additional cases, 10 additional state cases for a total of 19 on that day. So that's what we're trying to show with the yellow bar graph. Next slide, please. And this one shows for all of the state data dumps, we're putting them in there in the right place, wherever the lab actually was taken on that day. It wasn't taken on the day that they sent it to us. It was taken either back in June. You can see some yellows all the way back into June, and then all the yellows that are throughout the bell curve. So they don't change the bell curve much, except for right here. still goes up and it still comes down though. And then you're seeing less of the state data numbers. Next slide, please. So this is the circle diagram, and it shows recovered, which is a really another good news item that we're seeing a lot more individuals recovered, 19,061, which leaves 451 active cases. So people that are still sick with COVID-19, 451, which is a lot better than thousands of people that still have the virus. And we have 401 deaths. On this one, we have the hospitalized patients. And so you see from 134 going out 2 weeks, coming over to 81 hospitalizations. So the numbers continue to trend down, which is also a good sign. Next slide. In the ICU, you see the same, where you see the numbers are trending downward, and we have 31. We do know that for ICU patients, some patients you will lose them, and some patients will recover and will be discharged home to get better. The next slide. We did have a death today, so my condolences to the family of the person that lost their battle to COVID-19 today, and it brings our deaths up to 401 cases today. And then the final slide shows the daily count, and again, you've seen that trend where we were closer to the bottom, to zeros way out when, and then we went up right around the middle of July. We went to our peak of 605 cases, started trending downward, and we're slowly but surely getting down to where we want to be, single digits down to zero if possible. So, and that concludes the statistics for today. I did want to mention that yesterday the health district conducted a drive-through. 18 individuals were tested and only 2 tested positive, which is a positivity rate of 11%. That's one of the lowest positivity rates we've had in a while, so that's also some good news. For those individuals, and there was, I think, around 400 active cases who are COVID-19 positive and still need care or who have questions regarding their health, please call our COVID-19 outpatient clinic at 361-826-8019. This is a free service with medical experts available to help you recover. Recently, you've been hearing a lot about flu. We're talking about it so much because of the similarity in symptoms between flu and COVID-19. We want to make sure that everyone gets protected against the flu by getting their flu shot. Flu, just like COVID, if severe enough, can lead to hospitalizations. If we can prevent people being hospitalized from flu, we can also help hospital beds. We can help free up hospital beds for those more critical and also reduce the possibility of getting co-infected with flu and COVID-19. Flu season starts October 1st. CDC recommends that everyone 6 months of age and older get their flu vaccine. So people call us and say, so what if I'm pregnant? Can I get my flu shot? Yes. What if my baby's 1? Can I get my flu shot? Yes. What if my child's 7 months old? Can I get my flu shot? The answer is yes. Due to COVID-19, restrictions are in place in many places. So call ahead to your healthcare provider and or pharmacy to find out how they will be administering the flu vaccine, if it'll be via walk-in or via drive-through. With both COVID-19 and flu present, the schools will also face challenges with some face-to-face instruction, as well as football and other sport activities starting back up. Public health feels certain that wearing masks correctly and consistently when out in public is vital in reducing the spread of both these viruses. When out in congregate settings, masks should not be hanging off your ears or resting below your nose or chin. If your mask is too loose, then it needs to be tightened to ensure it fits properly. Governor Abbott announced today opening retail, restaurants, gyms, among others, to 75% capacity, beginning this coming Monday, if the hospitalization capacity due to COVID-19 was less than 15%, as it is here. We can be successful if we all work together to continue to drive our COVID numbers down by following the basic public health strategies. The health district has COVID agents inspectors that will be going to various locations throughout Nueces County to ensure businesses are following the safety guidelines in the Reopen Texas Plan. For the community, we want to say thank you for doing all that you're doing. Continue to practice your public health strategies. Practice the 3 W's. Wash your hands, wear a mask, watch your distance from others. Stay strong, stay protected, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 8 casos confirmados por el coronavirus. 19.061 pacientes se han recuperado por completo. 81 personas continúan en el hospital. 31 se encuentran en la unidad de cuidados intensivos. 451 casos aún están activos. El día de hoy se reporta un fallecimiento. A la fecha, los fallecimientos totalizan 401 personas. El día de ayer, el Distrito de Salud realizó la toma de 18 especímenes, de las cuales solamente 2 resultaron positivas, lo que hace una tasa de positividad del 11%. Si usted ha resultado positivo a la presencia del virus y tiene preguntas, puede llamar a la clínica al 826-8019. Este servicio es gratuito. En cuanto a la época de gripe, si tiene síntomas parecidos al COVID y una gripe no cuidada, puede enviar a una persona al hospital, por lo que es importante estar vacunado y prevenir una infección. Los Centros de Control de Enfermedades recomiendan vacunarse a todas las personas mayores a 6 meses. Con la reapertura de las escuelas y las actividades deportivas, también aumenta el riesgo al contagio. Recuerde usar su cubrebocas, asegúrese de que esté bien ajustado y continúe lavándose las manos frecuentemente. Le seguimos pidiendo no baje la guardia y continúe tomando todas las medidas de salubridad sugeridas. Lávese las manos con frecuencia, use un cubrebocas y manténgase a distancia de los demás.
Barbara Canales, Nueces County Judge. Director Rodriguez, I remember when we were worst in the country, and we said we wanted to be first in 90 days by October 16th. Even though we are not there yet, I think that if we are to get to be first again, those 3 W's are really what it's going to take, given that we are really coming back strong and getting into a much more normalized setting. So I want to do something that I really believe in, which is you tell them what you want to say, and then you tell them what you told them, and then you tell them what you told them again. So Mayor McComb told you, Director Rodriguez told you again, and or told you what he said, and now I'm going to tell you one more time, because I think it's people come into these press briefings at different intervals, and we really want to highlight the change today that Governor Abbott had regarding COVID-19 in his executive orders. The one thing I'm not sure we've emphasized is that he has also reauthorized elective surgeries for a majority of the state of Texas, including here in Nueces County. The governor also, of course, issued the new guidance relating to visitations at nursing homes and long-term care facilities across the state. Just moments ago when I walked in, Director Rodriguez and I discussed really what this means for families. And we want to make sure that everybody keeps that heightened vigilance when they're visiting their loved one in particular. There was a really strong and compelling reason why we did the unthinkable, keep you away from people you love in this state. And when the governor issued those orders, it was not because he didn't care, it was because he did. And so now that we can go in and see our loved ones, I got to make a phone call to a beautiful family who had been waiting for months and months to hug their mom, who, even though she suffers from serious Alzheimer's and dementia, she recognizes a hug. And so for all of those families who are waiting to be close to their loved ones again, we would just remind you, keep using those 3 W's so that we can make sure that you can see your loved ones and that it won't be taken from us again, because it's very clear the governor wants to make sure that we can be able to use these new orders in a way that makes our lives better. But he also warned that if we go backwards, there will have to be new orders in place. And so I will issue orders to reflect these new orders from the governor, and I'll do so tomorrow. We got these late enough in the day where we'll have to do some work, and we'll get them posted as early as tomorrow afternoon. So here is something I think very new for us to recognize, and that's how large and diverse our state is. And the governor implemented the use of reliable, data-driven hospitalization metrics used by doctors and the RACs and medical experts to help guide the state's ongoing efforts to contain COVID-19 and expand occupancy for business and services. And I just want to say amen to that, because I believe in that reliable, data-driven hospitalization metrics. We've used these here locally to help guide us in certain restrictions, and so has the governor, and it is, I think, the right way to make decisions. The metric focuses on area with high hospitalizations, referring to any, what we call the TSAs. Those are the trauma service areas. And there are, we look for 7 consecutive days in which the number of COVID as a percentage exceeds 15%. And until such time as the TSA has 7 consecutive days where it is 15% or less, that is the metric that allows us to ease restrictions. Nueces County, I'm very happy to report, is one of these 19 TSAs in Texas to qualify to increase our occupancy levels to the 75% that you already heard. I just want to emphasize why we got there. We got there because of these metrics, these real numbers that allow us to make strong, data-driven decisions in our state. I have always said that our approach to handling this pandemic would be informed here in Nueces County by science and driven by data, and today our data looks very good. And I had already written this and I said it earlier, but it's good again. Let's talk about it again. We haven't gone perfectly yet from worst to first, but boy, have we made major improvements. And this is not just in one category, but all categories, from rates of infections to numbers hospitalized, and even our number of COVID-related deaths has declined. I applaud this order today, and it gives us flexibility to increase restrictions when and where needed. And of course, to relax them if the data supports it. These are important to recognize. The use of hospitalization is so smart as a key metric, and it's what we used in the month of July to guide us here. The goal was always to flatten the curve, avoid mass infection outbreak, which would overwhelm our health system. And this metric measures our ability to handle these data points so that we can see who gets infected and who needs medical treatment. And of course, you'll recall this summer when things weren't looking good and our hospital capacity was very strained, our medical providers were being stretched very thin. This is still the case in some unique areas. And I do want to point out that it's all around us. The Rio Grande Valley, Laredo, and Victoria all did not meet those metrics. And you need to understand that on a map, we sit inside of that circle of Victoria, Laredo, and the Rio Grande Valley. That's why you can't let your guard down. So I've asked over time and received help from the state of Texas, and what the state could not have provided, the federal government and other agencies have. And as you guys know, we've had some dark days here in Nueces County where we had to ask for the unthinkable, things like morgue trailers. And we were sent all of these great resources from our state, including medical teams, testing teams, supplies, PPE. And over time, we have bent this curve, not just flattened it, we've bent it down. But curves, like roller coasters, can go back up as well. And that's why I want to increase the awareness going forward and urge everyone to continue to practice all of the prevention practices that we've adopted and, you know what, adapted to. It's not just that we had to adopt, we've adapted, which means they're now second nature. Masks aren't as uncomfortable as they once were. You're getting to use them in a way that you know protects you and you protect somebody else. Washing our hands, not touching our face, and of course, aren't we more aware than ever of the vulnerable that live amongst us? Our elderly, those that are immune compromised, those that live with respiratory issues and other comorbidities, If you or someone you know or love are in any of these categories, and particularly if you live with somebody who is, please be vigilant now. We want to be safe. We want our economy to work again, and we want to ensure that we have our personal freedoms. And what we are doing with occupancy limits and social distancing and hygiene are working, but they're working together in tandem, and we just can't let that guard down. So I'm, very happy, as I said, about the care facilities and the new rules so that families can once again be close to their loved ones. And all of this, of course, will go into place with regards to these assisted care living facilities on Thursday, September 24th. I want to make sure that we post all of the guidance. I don't want to go into great detail here because we will post it, but it's not like it's open season, okay? You're still going to be able to go in only one at a time. And that, of course, is to make sure that we're giving our physical and social and emotional needs the due that they deserve, but we're also making sure that we contain the virus, and so we want to keep maintaining that physical distance. There's also some rules. These abilities to go in are limited by the fact that we want to make sure that COVID-19 has not been present within 14 days of that facility. So I want to make sure that there's some rules, and again, we're going to post this on our website. There is still, unfortunately, that physical contact between residents and visitors that are not permitted, but I know that we will find ways to love one another despite some of these rules. And within time, I hope to be at this podium talking about the day when that particular rule is lifted as well. And I know that that this has been such a trying time for so many who have people who are living in these facilities, and so many that are afraid of having somebody they love have this terrible disease. So these rules make sense, and they require these protocols to be followed so that we can all be safe. So again, they're going to limit the number of caregivers, and this is very important. But with proper precautions, you at least get to come see your loved ones. So let's wrap up, and let me just tell you that I believe that we've been given a lot of opportunity to weigh and reflect this summer. And I think it's the last day of summer coming up, like next week. And as we enter into a new season, let it be a new season for us also to renew that this disease tests our humanity every day. It tests it because every action we do is testing whether we can stop the spread of this disease. And it has to be weighed against all the negative costs that sometimes come at this very heavy price. And so we have to consider all of the other emotions, and we have to understand that there is loneliness and sometimes fear and even despair. But we also must understand that there is also comfort and companionship, assurance and peace that can also be had. So I want to encourage all Texans, particularly those here in Nueces County, to heed the guidance of all the medical experts, particularly our own local health authority, and maintain our highest health and safety standards to mitigate COVID-19 and getting our Texas economy open at the same time. Thank you for everything that you do. All of you first responders and healthcare workers, and all of our essential workers who keep food on those shelves, keep the lights on and the water flowing, and allow us to remember to adapt as needed. We owe it to ourselves and to each other, and especially to all of those essential workers, to continue to do our part and to help keep our community safe and keep us on a path to recovery. I look forward to visiting with you. Actually, tomorrow, I want to take this opportunity to say I have a press conference at Nueces County Courthouse. I've invited a lot of friends and a lot of electeds by Zoom. And the purpose of tomorrow is to talk about the census and its incredible impact to our community. I want to say right now that I've had to, as an elected, deal with a lot of 911s in the last 6-7 months. I am not exaggerating when I tell you that filling out your census at this time is a 911. If we have any hope to get the federal dollars that we need for health care in this community, it's going to depend upon you filling out that census. So please tune in tomorrow at 10 a.m. to find out how you can be a part of the solution and make sure that we can get out the count. We stand to lose $1 billion if we don't do it right. So look forward to visiting with you about that subject matter, and of course, always stand ready to discuss COVID-19 with any of the members of the press. Thank you.
El día de hoy el gobernador actualizó sus órdenes ejecutivas que amplían los niveles de ocupación para algunos establecimientos. El gobernador también anunció una nueva guía relacionada con las visitas a hogares de ancianos e instalaciones de atención a largo plazo en todo el estado. Yo voy a emitir órdenes para que el condado de Nueces refleje estas nuevas órdenes del gobernador. Esto lo voy a hacer el día de mañana. El gobernador implementó también el uso de métricas de hospitalización. Esta métrica se enfoca en áreas con altas hospitalizaciones, refiriéndose a cualquier área de servicio de trauma que ha tenido 7 días consecutivos en que los números de pacientes hospitalizados por COVID como porcentaje de todos los pacientes hospitalizados excede el 15%. El condado de Nueces califica para aumentar los niveles de ocupación al 75% en algunos negocios a partir del 21 de septiembre. Hemos tenido una gran mejora en nuestras tasas de infecciones, en nuestro número de hospitalizados y en el número de muertes relacionadas al COVID. Las curvas también pueden volver a subir. Es por eso que insto a todos a que sigan practicando todas las buenas prácticas de higiene y prevención que hemos adaptado. Como se mencionó, el gobernador anunció una nueva guía de visitas para hogares de ancianos elegibles, centros de vida asistida, centros de atención intermedia, proveedores de servicios basados en el hogar y la comunidad y hospicios para pacientes hospitalizados a partir del jueves 24 de septiembre. Los residentes podrán designar hasta 2 cuidadores y no se va a requerir que los cuidadores designados mantengan distancia física. También hay nuevas reglas para los visitantes generales que no son un cuidador esencial designado. Estas reglas tienen sentido, requieren que se sigan protocolos para ser lo más seguros posible. Limiten el número de cuidadores, pero es vital permitir que los cuidadores, familiares o amigos tengan acceso para estar con sus seres queridos, que se encuentran en hogares de ancianos y otras instalaciones. Con las debidas precauciones, las nuevas reglas permiten visitas a sus seres queridos. Gracias por todo lo que continúa haciendo para observar las reglas y a nuestros proveedores de atención médica, personal de primera respuesta y a todos nuestros trabajadores esenciales que han mantenido alimentos en los estantes, han mantenido las luces encendidas y el agua fluyendo y nos han permitido para adaptarse según sea necesario. Nos lo debemos a nosotros mismos, los unos a los otros, especialmente a todos esos trabajadores esenciales, seguir haciendo nuestra parte para ayudar a que nuestra comunidad sea segura y mantenernos en el camino hacia la recuperación de esta pandemia. El día de mañana también voy a tener una conferencia virtual relacionada al censo. Es de suma importancia. Esta se va a llevar a cabo mañana a las 10 de la mañana.
All right, that wraps up the briefing. If you got any questions for the judge or Annette, leave. They won't leave if you got questions, but everybody's good? Just one more reminder that the judge will be working on her orders, and we will get those and get them with our city attorney to make sure they meet all our rules, but they'll be reflective of what the governor does. But for those that are planning for the 75% capacity, that's Monday, September the 21st. So again, retail stores, dine-in, office buildings, manufacturing businesses, museum, libraries, and gyms. So you can begin to make your planning, doing what you need to do for September the 1st, and that gives both the judge and Mr. Zanoni time to get our orders properly drawn and issued so that they'll be in place at the midnight hour Sunday night. So, and then on the 24th is the other date concerning the assisted living centers and others. So our orders will be in place on those 2 dates, and they'll be coming between now and Monday, if not sooner. So if no questions, that completes the briefing. Thank you very much.